I'm the Chief Health Officer. I'm the Chief Operating Officer of the Southern Nevada Health District. So it's my responsibility to help shepherd the accreditation process. Of course, as you know, there are staff who really are in charge of doing the day-to-day work of it, but it's my job to make sure that it goes smoothly and that all of our employees are on board with getting accreditation for us. The accreditation process has been going on for a couple of years now, and we were involved up in Washoe County when I was the health director up there. And we didn't get very far. We didn't have any funding. As you know, Southern Nevada Health District several years ago did have some dedicated funding, but then because of a variety of things, the funding was still there, the funding was used, but the process fell apart. So up in Washoe County, we started with a quality assurance, quality improvement committee, and we went into further accreditation, and they're continuing to do that without my leadership now. And I think you may know that Washoe County Health District was named as a collaborating health district with Southern Nevada when it got its grant, and so we came down for some of the briefings and meetings that Dr. Sands at the time held down here in Southern Nevada. From my point of view, there are two reasons to do that. One is to improve our quality, improve our services to the public, to make sure that we're using the taxpayer's dollar in the most efficient way. That's part and parcel of why you do quality improvement, quality assurance. The second reason, however, is that the further along we go, the more likely it is that CDC and other funding agencies are going to require accreditation or being involved in the accreditation process, or either our grants may be cut or we may not be eligible for grants. So it's important financially as a district that we continue to reach for accreditation. It's become very clear that the federal government likes the thought of accreditation and are funding the accreditation process to begin with. The CDC, HRSA, SAMHSA likely, and other federal agencies are likely going to require that we become accredited, or as I mentioned earlier, that we are in the accreditation process to be able to get full funding. The Southern Nevada District Board of Health is very supportive of accreditation efforts. During my interview, which occurred about a year and a half ago now before they hired me, that was one of the questions they asked. I've been in other jurisdictions where there was some scoffing at the thought that accreditation or some of the issues related to becoming accredited would really be helpful, that they might be more costly to us than they were helpful to us. But I didn't get that from our board. What I got from our board was that they wanted us to become accredited and they wanted to make sure that I knew about it and that I was on board before they hired me. I'm really excited about finding about the community health assessment piece of it. The entire process is very important, but how do we serve our customers? And we have a variety of customers. We have environmental health customers. We have people who work for restaurants. We have people who are getting permits. We have people who come in for TB care, for family planning, for immunizations. Where should we be located? This is a huge jurisdiction. Hour and a half north to Mesquite, a couple of hours south to Laughlin, hour and a half to Boulder City. And so we're a very large district. I want to know where the pockets of need are so that we can provide services better to that population. For example, if we know that there are certain zip codes that are underserved or are under-immunized, that's where we need to focus our immunization efforts. If there are areas, and we know there are, where there's a high birth rate among teens, and especially a second birth to high-risk teens, that's where we need to be focusing our family planning efforts to get our services out to the public. Well, I think there'll be a bit of a culture change. I think that everyone here wants to provide the best services that they can, from an administrative clerk through the nursing staff, through the professional environmental health staff. I think everyone wants to do that. But by becoming accredited, we institute several programs on quality assurance, quality improvement, and that will be enculturated. That will be part of our culture going forward, so that when we find issues, we'll be able to address those, find the root cause of what the problem is, change our procedures, change our protocols, and improve for the better and continue. When we start to be able to determine where we should be located with outpatient services outside of our main building, where environmental health services and people should be stationed in order to provide the best services, I think the community will be better served. We have started to do that already. We have moved some of our environmental health people over to 333 North Rancho, which is where the city of Las Vegas has its developmental services, so that we're now co-located with building permits, and that's going to improve service to our public as well. We want to continue that process by using accreditation procedures.